Alex from iCamin, please get on the stage. Thank you.
Hello everyone, I'm Alex from iCamin. Let me start with a short story. More than 10 years ago, my parents have founded a nursing home for elderly. Not long after, I realized that I will be the one responsible to handle the things after they will get bored or tired of doing it. So several years ago, I quit my job as a manager in telecommunications and literally moved into the nursing home, even slept there, to understand the processes, to improve them, and to create procedures. Even after applying the know-how and the knowledge from the corporate area, the problem was that we were spending way too much time on papers instead of truly caring for elderly. So our solution was to develop an internal tool that will help us overcome our day-to-day frustration in our job, such as paperwork that used to take us up to 1 hour, now is being done in 5 minutes or less. Also, when a new team member joins, she will know from the day one how to apply the personalized care for each elderly. So we developed and used this product only for our own needs. It's just several months ago when a medical doctor visited us and saw how easily our nurses work from tablets or smartphones, and he requested us to implement the system in the public hospital he was working in. Long story short, we didn't go to hospitals but to other nursing homes. We improved our internal tool and it's become iCamin. It's a SaaS that deals with paperwork more than 10 times faster, while keeping the knowledge of the business in the hands of the business owner instead of in the minds of the employees. Also, the business owner can easily appoint a new manager if needed, and this eliminates all the struggle managers had so far. Today, we serve more than 100 nursing homes, and we say that we saved more than 1 year of work days for hundreds of users that use iCamin, dealing with thousands of documents and serving more than 2,000 beneficiaries around the country. We foresee a natural organic growth to 300 nursing homes in the next year. Of course, there are some new spots unveiling on our roadmap, such as people calling us for certified nursing homes around the country, proper for their specific needs, and also people looking for jobs in this social area. The moment is good right now since the number of nursing homes has doubled in the last few years, despite the pandemic period and the harsh treatment the elderly had in this period. Also, there are no other softwares, at least in Romania, that are addressing this issue. People are still using pen and paper, and our problem is that some of them are really attached to it. Along with our core team, we are using also our nursing home team as an incubator for development and improving our project. Please make us warm intros to owners or other people working in nursing homes in Romania or even abroad. We are also willing to pilot some projects abroad. We are going to have the Q&A session, and here it's a presentation of how the app looks on the mobile phone or on the desktop, laptop, tablet. It's a progressive web application that easily can be used natively on each platform. Thank you.
Thank you, Alex. Okay.
Very impressive, from 3 to 100 to 300. Nice numbers. What data do you collect?
So we are following a very specific process, the natural, the old style process. When entering a beneficiary, a new beneficiary in the nursing home, you have to do the administrative papers, such as contract, appendix, declarations, and this managerial stuff took also very long. We now just enter one time all the information for the beneficiary, for the family, and for contract periods and so on. And with one click of a button, all the documents are in the system, and the beneficiary enters the flow for the nurses, for the social worker that has to do some reports, some social information, and so on. So what data? All data already requested in this social paper and medical paper after, for example, entering the treatment scheme, the daily administration of the drugs, the confirmation of administration, and then the medical information when some doctor is visiting the center and so on.
What is written there, for me, it seems to be interesting because it's a very quickly transfer of the information about the patient from the room to the physician. In fact, this makes the time very quickly and means more than one application for this because it's also something about emergency, if you want. I hope also that the physician answer very quickly. But if it is like this, it seems that you have tested until now because this increase in number of the facilities demonstrate the use of this. Yes, I think it is something seems to be not very complicated, but very useful. Yes.
Thank you. Thank you. Yeah, we aim to be very easy to use because we really know the nurses and other people working in nursing home. They are willing to use a very simple application and way of entering the data.
A very short question. Why don't you test with one or two in 2-3 different countries? Just translate the application. Why didn't you do that until now?
We have lots of work to do here because we started from a social mission of heart. We are willing to do this. We are waiting for a really warm contact. We already had discussions in UK, in Italy, in Spain, but we didn't have a warm contact, and we already know the agenda of a business owner in this field. Also in Romania, sometimes it takes 6 months until he calls, okay, let's start, let's begin using it. And
I think in Italy we have many Romanians working in environments like this, or in many places, I think Holland and...
Actually, 12 years ago and so, I had an Erasmus scholarship in Italy and visited also nursing homes around Calabria and that region because of their knowledge and their history in this field.
The idea is that when you change the culture, you'll have new discoveries. So we are, and also we want to be even more proud of you guys as Romanians that you are in more countries.
Yeah, thank you, thank you. Shortly, you have some warm contacts for me in other countries you can help with?
There we go.
It's a very good question, but unfortunately no. But I think you can find it relatively easy, like...
Good ask for the networking session.
Thank you.
Thank you, Alex.
Thank you.
Just translate it and put an international domain.
Okay, thank you.
Thank you. Okay. You are already here. Great work.